Hey guys, welcome back to my YouTube channel. In case you are watching me for the first time, please consider subscribing, and you can also share my video, like and comment, and don't forget also to turn your notification bell so that every time I post a video you will be the first person to be notified. So somebody told me to talk about what is called halitosis, not halitosis, halitosis, and this is bad breath. And as we know nowadays, or not even nowadays, bad breath can cause stigmatization, it can cause loneliness, it can cause depression, it can cause lack of friends, that is loneliness, and it can affect you psychologically, physically, emotionally. So it is something serious. So today I want to talk about the causes and how it can be prevented or how it can be treated. So I will start by the causes. So the first cause of bad breath is food. You get that digestion usually starts from the mouth, and in the mouth is where breakdown of food happens, and this breakdown of food can increase bacteria into your mouth, causing bad breath. And these bacteria can be taken into the bloodstream, and you know that blood usually move, or it is usually taken to all parts of the body. So when the bacteria enter into the bloodstream, and obviously it will go to the lungs, to mean, and it is in a simple way, you will the breathing, the smell of the breathing will be affected, or you will breathe bad breath, or when you breathe out it will be a bad smell. That is what we call bad breath, or you will be a candidate of bad breath or halitosis. That is cause number one. Cause number two is use of tobacco. Tobacco itself causes unpleasant smell, and tobacco also cause these gum diseases such as gingivitis, periodontitis, and these conditions usually cause bad breath. And so when you're using tobacco will make you to be a candidate of halitosis or bad breath. Number three, poor dental hygiene. Usually the dentists usually tell us you after every meal you're supposed to do what? To brush your teeth, so as to avoid the growth of microorganism in your mouth and in your teeth, that this microorganism can cause cavities in your teeth. And because most of the people during the day is when they work, so somebody cannot carry a toothbrush and a toothpaste to work, so that every time this person get a bite or take a breakfast or a lunch or any meal, this person have to brush his or her teeth. That is impossible. But because, yes, I've said, because we cannot manage to brush our teeth after every meal, it is always advisable that every time at night when you are going to sleep, you should brush your teeth. This is because, you know, at night you are not talking, you are not eating, you are silent. And microorganism, that is the time they will get that sweet time to digest the teeth, and also to cause bad breath, or to make you have some bad smell. That is why everybody, when you wake up in the morning, you usually have bad smell. So when you don't brush your teeth when you are going to sleep, you encourage microorganism in your body. And this microorganism, as I have said earlier, they can enter into the bloodstream, taken into the lungs, And what will happen? You will be a candidate of bad breath. That is cause number 3, which is poor dental hygiene. Cause number 4 is some medication. Some medication can be they can be broken down into chemicals, and they can cause bad breath. And at the same time, some medication has bad breath, has bad smell. So when you take them, you can be a candidate of bad breath. Number 5, infection. If you have been done for any surgery in your mouth, or you have wounds and you don't take a lot of hygiene, you will be a candidate of bad breath. And number 6 is also some gum diseases, such the one that I've said, gingivitis, periodontitis, and also some nose, ears, nose, throat diseases such as what? Tonsils. When you have this condition, you can usually be a candidate of bad breath, because there is what? Microorganisms that are being broken down into your mouth, and they're taken into the bloodstream. And you know, the way I've said earlier, the blood will be taken into the lungs. And what will happen? You know it very well. So those are some of the causes of bad breath. And how can you treat this bad breath, or how can you prevent it? It is very simple. Number 1, make sure you have or you practice a proper dental hygiene or oral hygiene. You will never have problem with bad smell in the morning or anytime, or you will never have problem with bad smell anytime. Number 2, in case the cause of this bad breath is infection, treat that infection. And for example, if you have gingivitis, treat it. Those are gum diseases that can be treated. So treat this infection. In case you are taking or you are smoking tobacco, please stop it. In case you are smoking tobacco, please stop it. You can also quit or avoid using some spices that can encourage a microorganism in your mouth. And also, you do what? I've said you maintain high oral hygiene, you quit smoking, avoid spices, and the last one, stay hydrated, because also another cause of bad breath is also dry mouth. And you know that dry mouth, when your mouth is dry, that is when microorganism does what? Then that is when you will have microorganism in your mouth. And you know that when you are hydrated, the saliva will help in cleaning the mouth. So stay hydrated, you will never have bad breath. So I want to say thank you for watching this video. Let's meet in my next video. Bye.